Welcome back to another Medical Mondays. I'm Dr. Alex Spinoso, and today we're going to talk about natural testosterone boosters. I get this question all the time from everybody. How can I boost my testosterone? How can I boost it? Well, I'm going to talk about 6 different supplements today that have some sort of data supporting increase in testosterone. There are a million things out there, so if you have any questions, I'm sure I'm going to miss some things, message me below and I'd be happy to talk about it with you. Otherwise, testosterone boosters have been at the forefront of supplementation forever. Males always want to learn how to boost their testosterone, how to increase muscle mass, how to increase lipolysis and fat loss naturally. These supplements aren't like your anabolics. If you take them, you're not going to all of a sudden go from skinny wimpy guy to Arnold Schwarzenegger in the matter of months. But they will increase your testosterone a low amount. And they aren't like those testosterone boosters that you see at Circle K in the little packages on the shelf, extends and stuff like that, which, if you were wondering, is pretty much only a bunch of caffeine and Viagra. So I'm going to go through each of the 6 supplements, and I'm going to put their names below so you can actually read them, look them up. They're a little bit hard to pronounce, so I might pronounce some of them wrong. The first supplement is called ashwagandha root. Now, ashwagandha root has been shown over an 8-week period to increase muscle size of both the arms and the chest, as well as increase bench press and leg extension strength. This is one of the most promising supplements out of all of the natural supplements to increase testosterone because it's one of the few ones that actually showed a physical difference rather than just a testosterone level difference. Patients taking ashwagandha root also showed a decrease in body fat and increase in lean body mass, as well as decrease in strength and increased semen levels. So you can take it if you're having trouble with having a child, things like that, as well as if you want to increase size of your muscle. Now, the dosing level for this is around 600 milligrams a day, and that's what most of the studies show. The next supplement we want to talk about is zinc. Now, it may be weird that zinc is one of the most common supplements that you can use to increase testosterone, but it's also one of the most common supplements we use to help people get over the common cold and sicknesses, because zinc plays a huge part in metabolism in the body as well as the immune system in the body. The studies surrounding zinc were over a 1-month, 4-week period, and what patients did is that they took people and they exercised them to the point of exhaustion, meaning that the muscles were starting to fail and they started to cramp up. So they took a group and they exercised them to the point of exhaustion and then just gave them normal water, electrolytes, things like that. The other group, they gave the people zinc before they did the exhaustion exercises. The exhaustion exercise actually lowered the levels of thyroid and testosterone hormones in these patients who were exercising to exhaustion. However, when they were given zinc, the levels of thyroid and testosterone stayed the same the entire time. They did not actually lower after the exercise, which translated to these people being more active, having more muscle, and increasing fat burning. The normal dosing for zinc is 3 milligrams per kilogram per day. So you take your weight, divide it by 2.2, that gets your kilograms, and then multiply it by 3, and that's how many milligrams you should have of zinc a day. Number 3 is DHEA. Now, DHEA is a precursor to sex hormones, testosterone and estrogen. And so many people think that if I take more DHEA, I'm going to get more testosterone, I'm going to get bigger. However, most of the studies show that even if you're taking supplemental DHEA, there is no significant difference in levels of testosterone, nor is there any significant difference in muscle mass while taking DHEA. There is, however, a benefit in DHEA for people who have hypoadrenalism, either by genetic or by taking anabolic substances so much in the past that their natural adrenal hormones are not produced. So in these people, the DHEA has been shown to increase testosterone levels if you have hypoadrenalism. So it might be beneficial to some people who have burned out their adrenals or are suffering from adrenal fatigue because of the fact that they've either used in the past or they're exhausted, have a lot of stress, or they naturally, genetically have problems with their adrenal glands. The dosing for DHEA is 25 to 50 milligrams per day. Now, I take DHEA myself Not because of the studies, but because I actually feel better on it. I'm not promoting it. Everybody's very different, but I do notice the difference when I'm supplementing with the DHEA versus not using it at all. Ginger. Now, ginger root is all over the place in all different types of foods. You can get ginger tabs from anywhere. The biggest thing with ginger is fertility. Not so much increases of testosterone, but fertility. And a study published in 2012 showed taking 50 to 100 milligrams per kilogram of ginger a day increased sperm count by 16% and increased sperm motility by 47%. So if you're looking to get pregnant, load yourself up with ginger. Number 5 is called fenugreek. Now, fenugreek is one of the most controversial of the testosterone boosters. Why? Because all the studies show that it doesn't actually boost testosterone objectively. However, subjectively, every single patient in all the studies that were taking fenugreek felt like they were stronger, felt like they had lost more fat. They actually felt better the whole time. And most of the time, humans don't care about numbers. In medicine, we try and say, treat the patient, not the numbers. So it didn't matter what the testosterone levels showed, that they were unchanged. What mattered was that every single patient actually stated that they felt better, that they had more energy, that they were increasing in their muscle mass, despite the fact that testosterone levels were the same at the beginning and the end of the trial. Now, these patients were taking fenugreek 600 milligrams a day for 6 weeks, and it made a significant difference in how they were feeling, their muscle mass, as well as their sexual performance. So fenugreek is definitely one that helps a lot of people, but there isn't a lot of proven scientific data showing numbers that increases testosterone. Number 6 is called bindi, or Tribulus terrestercis. I know, try and say that 5 times fast. And this one is for the ladies. So this is a plant that grows in North America and shows very promising studies when it comes to female levels of testosterone and infertility. This is also shown to really help those patients, again, that have androgen issues or adrenal issues. Patients that were given this bindi over a certain period of time showed increase in libido, increase in their sexual drive, increase in fertility, as well as increase in muscle mass from increased testosterone. Now, the bindi did not have effects in healthy males nor young, healthy females who had normal testosterone levels, who had normal adrenals. So if you are having hypoadrenalism, or if you have problems with libido, sex drive, things like that, females, bindi, this may be one to look up. Number 7, and the last one, is D-aspartic acid. Now, this is an amino acid that's produced in the body, mainly in the pituitary gland, which hangs on the bottom of the brain up here. Now, this controls sex hormone creation. This has been shown to increase both luteinizing hormone, LH, and testosterone when taken over a course of as little as 12 days. So those are the most common supplements and the most studied supplements that people can use to increase their natural testosterone levels, or to increase their libido, their feeling, or to increase muscle mass. Now, these are all natural substances. None of them are anabolic, so they're not going to have the effects of anabolics. So if you look at those guys that in 3 months, 4 months, they've packed on 10 pounds of muscle, 12 pounds of muscle, that is not natural. These supplements are not going to get you to that level, unfortunately. However, taking them over a longer period of time will help you. Lastly, what are some ways to improve testosterone levels without having to take anything? So, for both men and women, that's have sex. Sex is going to increase endorphins, which increases testosterone levels. Sleeping more will also have issues. Remember, watch my video on sleeping at least 7 to 8 hours a day, 7 being the minimum. Stress reduction. You can use cortisol blockers, meditation. You can use the ashwagandha root. However, stress is going to be a big part of increasing and decreasing testosterone levels. Exercise. Exercise is going to increase your testosterone levels naturally. And lastly, water. Drinking the proper amount of water, at least 100 to 120 ounces a day, ensures proper blood flow to your adrenals, which allows them to function properly and allows them to produce the adequate amounts of testosterone that you need in your body. Once again, I'm Alex Spinoso. This is Medical Monday. I appreciate you watching. If you have any questions, please message me below, DM me, comment, anything you want to ask me. I'll make it into a video. Hope you're having a great day. See you next Monday.